Hi Curry County residents, my name is Ginny Williams and I'm the CEO for Curry Health Network. And today I'd like to give you an update on operations at the network that are being impacted by COVID-19 and steps that we're taking to ensure that we can continue to provide services for you and your loved ones. Recently I've been asked by many folks if we have implemented our surge plan and how we've been impacted by patient volumes. And although we don't have tents outside, we definitely have plans to expand our capabilities, and I'd like to share some of those details with you. Currently, Curry Health Network, the hospital, is licensed for 18 inpatient beds. And we have two hallways running up on the third floor. One is on the east side with 10 rooms, the other is on the west side with 6 rooms, and to the south there are 2 rooms that are not currently being used for patient care. Right now, we have placed temporary walls up on the east side of the building, allowing us to surge up to 10 COVID patients. And on the west side of the building, those 6 private rooms remain available for non-COVID patients. If we have the need to go beyond 10 patients, we're prepared to relocate our non-COVID patients and to convert our pre- and post-op area into a non-COVID, if you will, medical surgical unit. That would allow us to surge up to 16 COVID patients on our third floor. We have not had to do that to date. Right now, we are just currently making sure that we have negative pressure rooms, again, sufficient for 10 people with COVID. And we have not had 10 inpatient COVID patients at one time. The most we've had is 7. However, with the trends that are being shared with us from experts in this area, the prediction is that things could get worse through the beginning of September. So we continue to work on our plans and to prepare our staff that if necessary, we will make that move. We also, I'm consulting some notes. We also did get approval from Oregon Health Authority to expand into our clinic space down at Curry Medical Center if necessary, allowing us to expand capabilities of our ER. And I mentioned earlier, you don't see tents outside because we believe it's much more efficient if we can use our interior space. Also, with the winds in our region, tents just really are not always the most optimal way for us to conduct our business. The next topic I want to talk to you about is pretty sensitive, and it has to do with posting our inpatient census information on a daily basis in addition to our ER volumes. And we're wanting to share that with you just so that you can get a sense of what's going on inside of our walls. Now you know we can typically manage 18 patients or license for 18 patients. That's not to say we're staffed for 18 patients, but by seeing that census, you can actually see if we get more than 10 inpatient COVID patients, that's when we've activated our surge plan and are moving our non-COVID patients out. But we are not posting the vaccine status of our patients. And we are too small of an organization and a community, and it is impossible to keep patients' private health information with some anonymity if we were to post the status of the vaccine status of our inpatients. So although the population seems to be very curious about this, it's safe to say that other larger organizations that can maintain anonymity are telling everybody that the majority of patients in their care are non-vaccinated patients. So you can rest assured we are not seeing any different of a trend, but we will not post on a daily basis how many patients have been vaccinated or not. And if you or one of your loved ones was in our care, you would want us to do everything to protect your privacy, as we will do for those patients that are staying with us. Today was a historic day. We have received the assistance of 11 National Guardsmen. These Guardsmen are not being brought here in any type of enforcement capacity, and they are not here to perform any clinical functions. They are here in a support fashion only. Curry Health Network has determined that we really needed their support in helping us to expand our hours of screeners at our entrances. And in addition, we need some assistance with just day-to-day operations for environmental services, our dietary department, and in our nursing units if a patient requires a sitter. Right now, we're having to call people in overtime to do that, and we really want to reserve our staff, especially our clinical staff, to be able to come in and care for additional patients. And so the National Guard will be part of our community. I hope you will welcome them. They will be staying with us at least until September 31st, unless it's determined we don't need their assistance before then. And they could be extended up through and as long as the end of December, according to the governor's orders. We will work with them very carefully to make sure that they don't remain with us any longer than we need them. And we will be agile with their time and their abilities as it would relate to functions we have them do. But again, they are not here in any type of enforcement capacity. The last thing, the second to last thing I wanted to share with you is related to our emergency room, and that has to do with COVID testing. It is true that our outpatient tests are all being sent out because we have limited numbers of rapid tests. However, please do not come to our emergency room just seeking a COVID test. Only come to our emergency room if you are seeking emergency medical services related to or unrelated to COVID. By taking up those resources to do a simple COVID test is not the best use of our resources. And if you're watching our volumes, you can see at times our ERs are very, very busy. So please, I ask again, if you need a COVID test and you do not require medical attention, you can go onto our website and make yourself an appointment. We allow drive-up testing at all of our locations throughout the week. We will make you an appointment to make that happen. Also, you can call our phone number at 541-412-2000, and we will also be able to make you a testing appointment if that's what you need. However, if you are in need of medical attention, we want to be able to care for you. Please come to our emergency room or call us, and we will make a safe appointment available for you to see one of our providers, either through telehealth or in person. The last thing I want to talk about is masks. I know that masks are controversial, but the law is that healthcare facilities require all staff, visitors, providers, and anyone within our facilities to be masked 100% of the time. So if you enter our facility, we will ask you to put a mask on. If you have a medical reason that you can't wear a mask, or you suffer from a disability that prevents you from wearing a mask, we will make available face shields for you. Sometimes those are a little bit more comfortable for people that just can't have something over their face. If you are unable to wear a mask or a face shield, one of our staff members will assist you in the safest way possible to get you the care that you need. Curry Health Network also continues to make vaccines available. If you are an individual that is seeking a vaccine, please call 541-412-2000. If you are 18 and older, we have vaccine appointments available 5 days a week. If, in fact, you are between the ages of 12 or 18, or you have a child between that age, you just need to call 211, and that line will be able to direct you to the nearest location where the Pfizer vaccine is being offered. We do not have ultra-cold storage here, and that's what prevents us from being able to offer the Pfizer vaccine. We do currently have plenty of Moderna vaccine, and if you're in the category and wanting a booster vaccine, please call that number as well, and we will make you an appointment. I hope this briefing is informative. I hope it puts some rumors to rest. I know it will generate more questions. As we receive questions, I'll be committed to posting more of these videos, so please don't hesitate to submit your questions to us either online or through Facebook. And I do hope that you are all staying safe during these they're historic times that we're seeing right now. I wish you all the best and take good care. Bye-bye.